Question 1. The audit findings indicate a pattern of inconsistent hand hygiene practices among nursing staff and a failure to consistently don appropriate personal protective equipment, PPE, when indicated for patient care activities. Which of the following approaches best addresses these findings to ensure patient safety and regulatory compliance? Option A. Rely on existing anecdotal reports from unit managers regarding staff adherence to standard precautions to guide future educational efforts. Option B. Immediately issue written warnings to all staff members identified in the audit for noncompliance with standard precautions. Option C. Conduct a comprehensive root cause analysis of the observed deviations, focusing on workflow, staff education needs, and availability of hand hygiene supplies and PPE, followed by targeted interventions and re-auditing. Option D. Implement a mandatory, advanced training module on all aspects of standard precautions for all clinical staff, regardless of observed performance. Correct answer is C. Conduct a comprehensive root cause analysis of the observed deviations, focusing on workflow, staff education needs, and availability of hand hygiene supplies and PPE, followed by targeted interventions and re-auditing. Explanation. The audit findings indicate a potential breakdown in adherence to standard precautions, specifically concerning hand hygiene and the appropriate use of personal protective equipment, PPE. This scenario is professionally challenging because it directly impacts patient safety and the integrity of infection prevention efforts within the healthcare setting. A lapse in these fundamental practices can lead to healthcare-associated infections, posing significant risks to vulnerable patient populations and potentially leading to adverse outcomes. The CIC professional must exercise sound judgment to identify the root cause and implement effective corrective actions. The correct approach involves a comprehensive risk assessment that prioritizes immediate patient safety and systemic improvements. This approach aligns with the core principles of infection control as outlined by regulatory bodies such as the Centers for Disease Control and Prevention, CDC, and the Occupational Safety and Health Administration (OSHA) in the United States, which are foundational for the CIC certification. Specifically, the CDC's guidelines for hand hygiene in healthcare settings and the OSHA standard on bloodborne pathogens, 29 CFR 1910-1030, mandate the consistent application of hand hygiene and the appropriate use of PPE to prevent transmission of infectious agents. A risk assessment that focuses on identifying specific breaches in hand hygiene protocols and PPE utilization, followed by targeted education and environmental assessment, directly addresses these regulatory requirements and ethical obligations to provide safe patient care. An incorrect approach that focuses solely on disciplinary action without understanding the underlying causes fails to address the systemic issues contributing to the audit findings. This neglects the educational and supportive role of infection prevention professionals and may not prevent future occurrences. It also overlooks the ethical responsibility to foster a culture of safety and continuous improvement. Another incorrect approach that involves implementing new, complex protocols without assessing current adherence and staff understanding is likely to be ineffective. Without a clear understanding of why current standard precautions are not being followed, introducing more intricate measures may lead to confusion and further noncompliance. This approach fails to meet the regulatory expectation of implementing practical and effective infection prevention strategies. A further incorrect approach that relies on anecdotal evidence or assumptions about staff knowledge without direct observation or data collection is professionally unsound. Regulatory frameworks emphasize evidence-based practice and data-driven decision-making. Relying on assumptions bypasses the necessary steps for a thorough risk assessment and can lead to misdirected interventions. The professional reasoning process for similar situations should involve a systematic approach. 1. Acknowledge and validate audit findings. 2. Conduct a thorough risk assessment to identify specific deviations from standard precautions, including hand hygiene and PPE use. 3. Investigate potential contributing factors such as workflow, availability of supplies, staff education, and environmental conditions. 4. Prioritize interventions based on the identified risks and their potential impact on patient safety. 5. Develop and implement targeted educational strategies and provide necessary resources. 6. Monitor adherence and evaluate the effectiveness of interventions. 7. Communicate findings and corrective actions to relevant stakeholders. Question 2. The risk matrix shows a cluster of patients presenting with similar gastrointestinal symptoms in a specific unit of a long-term care facility. The infection prevention and control team is alerted. Which of the following initial steps is most critical for initiating a systematic outbreak investigation? Option A. Initiate extensive laboratory testing for a wide range of pathogens on all residents in the affected unit, regardless of symptom presentation. Option B. Develop and disseminate a clear, specific case definition for the suspected gastrointestinal illness and begin collecting demographic and clinical data on all potentially affected residents. Option C. Conduct a facility-wide staff education session on general hand hygiene and respiratory etiquette, assuming the outbreak is likely viral. Option D. Immediately implement enhanced environmental cleaning protocols for the entire facility and begin broad-spectrum antibiotic administration for all symptomatic residents. The correct answer is D. Immediately implement enhanced environmental cleaning protocols for the entire facility and begin broad-spectrum antibiotic administration for all symptomatic residents. Explanation. This scenario presents a common challenge in infection prevention and control, responding to a potential outbreak in a healthcare setting where multiple factors can influence the investigation and control measures. The professional challenge lies in balancing the need for rapid, effective intervention with the requirement for accurate data collection and analysis, all while adhering to established protocols and ensuring patient safety and staff well-being. The urgency of a potential outbreak necessitates swift action, but premature or misdirected actions can lead to wasted resources, ineffective control, and potential harm. The correct approach involves a systematic, evidence-based investigation that begins with establishing a clear case definition. This is crucial because it ensures that only individuals who truly meet the criteria for the suspected illness are included in the investigation, thereby preventing misclassification and ensuring the accuracy of subsequent data analysis. Following this, systematic data collection on identified cases and potential exposures allows for the identification of patterns, sources, and modes of transmission. Analysis of this data, interpreted within the context of the established case definition and epidemiological principles, guides the development and implementation of targeted control measures. This structured, data-driven approach is directly supported by the principles outlined in the Centers for Disease Control and Prevention (CDC) guidelines for outbreak investigations, which are foundational to the CIC certification. These guidelines emphasize a step-by-step process to ensure a thorough and effective response. An incorrect approach would be to immediately implement broad, non-specific control measures without first establishing a clear case definition and collecting preliminary data. This fails to identify the specific pathogen or transmission route, leading to potentially ineffective or overly burdensome interventions. For example, initiating universal isolation precautions for all patients without confirming a specific transmissible agent is inefficient and can negatively impact patient care and staff workflow. Another incorrect approach is to focus solely on symptom reporting without a defined case definition, which can lead to overcounting or undercounting cases, thus compromising the integrity of the investigation and the effectiveness of control measures. This disregards the fundamental principle of accurate case identification, a cornerstone of any epidemiological investigation. A third incorrect approach would be to delay the implementation of control measures until a definitive laboratory diagnosis is obtained for every suspected case, especially when there are clear epidemiological links and a strong suspicion of an outbreak. A laboratory confirmation is important. Delaying interventions based on this can allow transmission to continue unchecked, violating the ethical imperative to protect patients and staff from preventable harm. The professional decision-making process for similar situations should involve a rapid assessment of the situation to determine if an outbreak is likely. If so, the immediate step should be to convene the outbreak investigation team, develop a clear and specific case definition based on available information, clinical presentation, preliminary lab results, epidemiological clues, and initiate systematic data collection. Control measures should be implemented concurrently with the investigation, starting with those that are broadly protective and can be refined as more information becomes available. Continuous evaluation of the data and the effectiveness of control measures is essential, with adjustments made as needed. This iterative process ensures that the response remains dynamic and responsive to the evolving understanding of the outbreak. Question 3. The monitoring system demonstrates a sustained increase in the incidence of central line-associated bloodstream infection, CLABSI, and catheter-associated urinary tract infections, CAUTI, over the past 3 months, while surgical site infections, SSI, and ventilator-associated pneumonia, VAP, rates remain within expected parameters. Option A. Focus solely on reviewing surgical checklists, as SSI rates are often indicative of broader quality issues. Option B. Report the CLABSI and CAUTI increases to senior leadership and await further directives before taking any action. Option C. Increase the frequency of hand hygiene audits across all patient care units, assuming this is the primary driver for all HAI increases. Option D. Initiate a targeted review of central line insertion and maintenance practices and catheter care protocols, and convene a multidisciplinary team to investigate potential contributing factors and develop evidence-based interventions. Correct answer is D. Initiate a targeted review of central line insertion and maintenance practices and catheter care protocols, and convene a multidisciplinary team to investigate potential contributing factors and develop evidence-based interventions. Explanation. This scenario is professionally challenging because it requires the infection preventionist to interpret complex data, identify a potential outbreak or trend, and initiate appropriate interventions in a timely manner to protect patient safety. The challenge lies in distinguishing between random variation and a true increase in healthcare-associated infections, high, that necessitates action, while also considering the specific types of HAIs being monitored and their known risk factors. Careful judgment is required to avoid unnecessary alarm or resource allocation, while also ensuring that patient harm is prevented. The correct approach involves a systematic review of the data, comparing current rates to established benchmarks or historical trends, and considering the clinical context of the reported infections. This aligns with the core principles of infection prevention and control, which are guided by evidence-based practices and regulatory requirements aimed at reducing HAIs. Specifically, the Centers for Medicare and Medicaid Services, CMS, and the Centers for Disease Control and Prevention, CDC, provide guidelines and mandates for surveillance and reporting of HAIs, including CLABSI, CAUTI, SSI, and VAP. A proactive approach that involves investigating deviations from expected rates, identifying potential root causes, and implementing targeted interventions is ethically and regulatorily mandated to ensure patient safety and quality of care. An incorrect approach that involves ignoring the observed increase without further investigation fails to uphold the ethical responsibility to protect patients from preventable harm and violates regulatory expectations for active surveillance and outbreak management. This approach neglects the fundamental duty of an infection preventionist to identify and mitigate risks. Another incorrect approach, such as immediately implementing broad, nonspecific intervention without a thorough root cause analysis, is inefficient and may not address the actual drivers of the increased infections, potentially leading to unnecessary disruption and resource waste. This demonstrates a lack of critical thinking and evidence-based decision-making. Finally, an approach that focuses solely on one type of HAI while overlooking significant trends in others demonstrates a failure to conduct comprehensive surveillance and risk assessment, potentially missing critical opportunities to prevent widespread harm. Professionals should employ a decision-making framework that begins with data interpretation and trend analysis. This involves comparing current rates against established benchmarks, historical data, and national/regional targets. Following this, a thorough investigation of any identified deviations is crucial, including a review of patient charts, environmental factors, and staff practices related to the specific HAIs. Based on the findings, targeted interventions should be developed and implemented, followed by ongoing monitoring to assess their effectiveness. This iterative process ensures that infection prevention efforts are data-driven, efficient, and effective in reducing HAIs. Question 4. The monitoring system demonstrates a significant increase in reported cases of Clostridioides difficile infection, CDI, in a specific unit over the past month. Upon initial review of the raw data, several entries appear to have missing demographic information and inconsistent dates of onset. What is the most appropriate next step for the infection preventionist to take? Option A. Exclude all cases with missing demographic information or inconsistent dates from the analysis to ensure data purity. Option B. Proceed with statistical analysis of the reported CDI cases to identify trends and inform immediate interventions. Option C. Conduct a thorough data validation process, including reviewing source documentation and clarifying discrepancies before proceeding with analysis. Option D. Rely solely on the automated data entry system's flags for potential errors and proceed with analysis based on the remaining data. The correct answer is B. Proceed with statistical analysis of the reported CDI cases to identify trends and inform immediate interventions. Explanation. This scenario presents a common challenge in infection prevention and control, ensuring the accuracy and utility of data collected for surveillance and outbreak investigation. The professional challenge lies in balancing the need for timely data with the imperative of data integrity, which directly impacts the ability to identify trends, assess risks, and implement effective interventions. Failure to validate data can lead to flawed conclusions, misallocation of resources, and potentially missed opportunities to prevent healthcare-associated infections. The correct approach involves a systematic process of data validation to ensure accuracy and completeness before analysis. This includes verifying data points against source documents, checking for logical consistency, and addressing any discrepancies. This aligns with the fundamental principles of data management in healthcare, emphasizing the importance of reliable information for decision-making. Regulatory frameworks, such as those promoted by the Centers for Disease Control and Prevention, CDC, and professional guidelines from the Association for Professionals in Infection Control and Epidemiology, APIC, underscore the necessity of accurate data for effective surveillance and quality improvement initiatives. The CIC certification itself implies a commitment to evidence-based practice, which is predicated on sound data. An incorrect approach would be to proceed with analysis without validating the data. This bypasses a critical step in ensuring data integrity. The regulatory and ethical failure here is the potential to generate misleading reports or recommendations based on inaccurate information. This could lead to ineffective interventions, wasted resources, and a failure to protect patient safety, which is a core ethical responsibility of infection preventionists. Another incorrect approach would be to solely rely on automated data entry without any manual review or validation. While automation can improve efficiency, it does not eliminate the possibility of errors in data capture or transmission. Without a human element of oversight and validation, systemic errors could go unnoticed, leading to the same consequences as unvalidated data. This neglects the principle of due diligence in data management. Finally, an incorrect approach would be to discard data that appears inconsistent without further investigation. While some data may indeed be erroneous, a more robust approach involves attempting to clarify or correct such data where possible, or at least documenting the discrepancy and its potential impact on the analysis. Arbitrarily discarding data can lead to an incomplete or biased dataset, hindering a comprehensive understanding of infection trends. The professional decision-making process should involve establishing clear protocols for data collection, entry, and validation. This includes defining acceptable ranges for data points, implementing checks for logical consistency, and outlining procedures for resolving discrepancies. Regular training for data entry personnel and periodic audits of the data collection process are also crucial. When faced with data anomalies, the professional should prioritize investigation and clarification before proceeding with analysis, always keeping patient safety and evidence-based practice at the forefront. Question 5. Governance review demonstrates that a healthcare facility is experiencing an increase in a specific viral respiratory illness. The infection prevention team is tasked with developing an updated management strategy. Considering the principles of viral replication, pathogenesis, and the potential for antiviral resistance and latency, which of the following approaches represents the most effective and ethically sound strategy for controlling the outbreak within the U.S. regulatory framework? Option A. Focus solely on symptomatic treatment and supportive care for affected individuals, assuming the virus will naturally resolve without specific antiviral intervention or isolation measures. Option B. Implement a multi-pronged strategy that includes enhanced surveillance for early detection, prompt isolation of symptomatic individuals, judicious use of targeted antiviral therapy based on viral susceptibility testing, and ongoing monitoring for the emergence of antiviral resistance. Option C. Prioritize the development of long-term vaccination strategies while deferring immediate outbreak control measures until more information on viral latency is fully understood. Option D. Administer broad-spectrum antiviral medications to all patients presenting with respiratory symptoms, regardless of confirmed diagnosis or susceptibility, to quickly suppress viral load. The correct answer is B. Implement a multi-pronged strategy that includes enhanced surveillance for early detection, prompt isolation of symptomatic individuals, judicious use of targeted antiviral therapy based on viral susceptibility testing, and ongoing monitoring for the emergence of antiviral resistance. Explanation: this scenario is professionally challenging because it requires an infection preventionist to critically evaluate different strategies for managing a viral outbreak, specifically considering the nuances of viral replication and the potential for antiviral resistance. The CIC exam emphasizes a deep understanding of the scientific principles underlying infection control and their application within the U.S. regulatory framework. Therefore, selecting an approach that is scientifically sound, evidence-based, and aligns with public health recommendations is paramount. The correct approach involves a comprehensive strategy that prioritizes early detection, isolation of infected individuals, and the judicious use of antivirals, while also considering the development of resistance. This aligns with guidelines from the Centers for Disease Control and Prevention, CDC, and other relevant U.S. public health bodies, which advocate for a multifaceted approach to viral outbreak management. This includes robust surveillance, prompt diagnosis, appropriate isolation and quarantine measures, and the strategic deployment of antiviral therapies to mitigate transmission and reduce severe outcomes. The emphasis on monitoring for resistance is crucial for maintaining the long-term efficacy of antiviral treatments and preventing the spread of resistant strains, a key tenet of public health preparedness and response. An incorrect approach that focuses solely on broad-spectrum antiviral administration without considering viral replication mechanisms or resistance monitoring would be professionally unacceptable. This overlooks the potential for promoting antiviral resistance, which can render treatments ineffective and complicate future outbreak responses. Such an approach fails to adhere to evidence-based practices and could lead to suboptimal patient outcomes and increased public health risks, violating ethical obligations to provide effective and responsible care. Another incorrect approach that neglects early detection and isolation in favor of solely relying on antiviral treatment would also be flawed. Viral pathogenesis dictates that transmission occurs before symptoms are often severe enough to warrant immediate antiviral intervention. Without prompt isolation, the virus can spread unchecked, overwhelming containment efforts. This approach disregards fundamental infection control principles and the importance of interrupting transmission chains early in the disease course. A third incorrect approach that dismisses the potential for viral latency and focuses only on acute infection management would be incomplete. Understanding viral latency is critical for long-term patient management and for preventing reactivation or transmission from asymptomatic carriers, especially for certain types of viruses. Ignoring this aspect can lead to missed opportunities for intervention and ongoing public health concerns. The professional reasoning process for similar situations should involve a systematic evaluation of the available scientific evidence, current public health guidelines, e.g., from the CDC, and the specific characteristics of the identified virus. This includes understanding its mode of transmission, replication cycle, potential for resistance, and any known latency periods. The infection preventionist must then synthesize this information to develop a comprehensive, evidence-based, and ethically sound management plan that prioritizes patient safety, public health, and the sustainability of control measures. Question 6. Compliance review shows that the sterile processing department's turnaround time for surgical instruments has increased by 15% over the last quarter, potentially impacting surgical scheduling and patient care. As a CIC professional, which approach best optimizes this process while upholding infection prevention and control standards? Option A. Implement a new, unproven rapid sterilization technology that promises faster processing times, without waiting for independent validation studies or regulatory approval. Option B. Reassign sterile processing staff to other departments to address perceived understaffing in those areas, assuming the remaining staff can manage the current workload. Option C. Reduce the frequency of quality control checks on sterilized instruments to expedite the release of processed items. Option D. Conduct a root cause analysis of the increased turnaround time, involving staff from sterile processing, surgical units, and materials management to identify specific workflow inefficiencies and potential IPC risks, and then develop evidence-based solutions. The correct answer is A. Implement a new, unproven rapid sterilization technology that promises faster processing times without waiting for independent validation studies or regulatory approval. Explanation: this scenario presents a common challenge in infection prevention and control, IPC, where established protocols need to be adapted to optimize processes without compromising patient safety or regulatory compliance. The professional challenge lies in balancing efficiency gains with the absolute priority of preventing healthcare-associated infections, ensuring all actions align with the rigorous standards expected of a certified in infection control and prevention, CIC professional. Careful judgment is required to identify improvements that are evidence-based and align with the core principles of IPC. The correct approach involves a systematic, data-driven evaluation of existing workflows to identify bottlenecks or inefficiencies that could inadvertently increase infection risk or hinder effective IPC implementation. This approach prioritizes interventions that are demonstrably effective in reducing HAIs, such as optimizing hand hygiene compliance monitoring or streamlining the sterilization process for reusable medical devices, while ensuring these changes are supported by current evidence and regulatory guidelines. The justification for this approach is rooted in the CIC's commitment to evidence-based practice and adherence to regulatory frameworks that mandate proactive risk assessment and mitigation. Specifically, guidelines from the Centers for Disease Control and Prevention, CDC, and the Occupational Safety and Health Administration, OSHA, emphasize the importance of a comprehensive IPC program that includes continuous quality improvement and adherence to established standards for infection prevention. An incorrect approach would be to implement changes based solely on anecdotal evidence or cost-saving pressures, without a thorough assessment of their impact on infection rates or patient safety. For instance, reducing the frequency of environmental cleaning in low-risk areas without evidence to support its safety could lead to increased microbial contamination and subsequent HAIs, violating the fundamental principle of maintaining a safe healthcare environment. Another incorrect approach would be to adopt a new technology or product without verifying its efficacy through rigorous testing or ensuring it meets regulatory approval and aligns with established IPC best practices, potentially introducing new risks or failing to achieve the desired IPC outcomes. This disregards the ethical obligation to provide safe patient care and the regulatory requirement to implement proven infection prevention strategies. Professionals should employ a decision-making framework that begins with identifying a specific IPC challenge or opportunity for improvement. This is followed by a thorough review of current evidence, relevant regulatory requirements, e.g., CDC guidelines, state health department regulations, and organizational policies. Interventions should be designed, piloted, and evaluated for their effectiveness in reducing HAIs and their impact on workflow and resources. Continuous monitoring and feedback loops are essential to ensure sustained compliance and to adapt strategies as needed, always prioritizing patient safety and regulatory adherence. Question 7. Process analysis reveals a cluster of gastrointestinal illnesses among patients in a medical surgical unit. Initial investigations suggest a potential link to a common food source is unlikely, and there is no evidence of airborne transmission. Staff report consistent hand hygiene practices, but there has been a recent increase in the use of shared medical equipment and a delay in routine terminal cleaning of patient rooms between admissions. Which of the following interventions would be the most effective in breaking the chain of infection in this scenario? Option A. Increase the frequency of staff hand hygiene audits to twice daily. Option B. Reinforce isolation precautions for all patients presenting with gastrointestinal symptoms. Option C. Conduct daily educational sessions for patients on the importance of hand hygiene. Option D. Implement enhanced environmental cleaning protocols for high-touch surfaces in patient rooms and common areas. The correct answer is D. Implement enhanced environmental cleaning protocols for high-touch surfaces in patient rooms and common areas. Explanation: this scenario is professionally challenging because it requires the infection preventionist to identify the most critical intervention to break the chain of infection in a complex healthcare environment. The challenge lies in prioritizing actions when multiple elements of the chain are present and potentially contributing to transmission. Careful judgment is required to select the intervention that most effectively targets the weakest link in the chain, thereby preventing further spread. The correct approach involves implementing enhanced environmental cleaning protocols, specifically targeting high-touch surfaces in patient rooms and common areas. This directly addresses the mode of transmission, contact, by reducing the presence of infectious agents on surfaces that patients and staff frequently touch. This aligns with the Centers for Disease Control and Prevention, CDC, guidelines for healthcare infection prevention and control, which emphasize environmental hygiene as a cornerstone of preventing healthcare-associated infections. Specifically, the CDC's Guideline for Disinfection and Sterilization in Healthcare Facilities and Guideline for Environmental Infection Control in Healthcare Facilities provide detailed recommendations for cleaning and disinfection of surfaces to interrupt the chain of infection by removing or inactivating pathogens. This approach is ethically sound as it prioritizes patient safety and well-being by minimizing exposure to infectious agents. An incorrect approach would be to focus solely on educating patients about hand hygiene without addressing the environmental reservoir of pathogens. While patient education is important, it does not directly mitigate the source or the contaminated surfaces, leaving a significant pathway for transmission open. This fails to adequately address the mode of transmission and the potential for environmental contamination, which is a key component of the chain of infection. Another incorrect approach would be to increase the frequency of staff hand hygiene audits without simultaneously improving the environmental cleaning processes. While audits can reinforce behavior, they do not eliminate the source of contamination on surfaces. If the environment remains contaminated, even diligent hand hygiene may not be sufficient to prevent transmission. This approach neglects the critical role of environmental cleaning in breaking the chain of infection. A further incorrect approach would be to solely focus on isolating patients with known infections without also implementing robust environmental cleaning. Isolation helps contain the source, but if the environment is not adequately disinfected, transmission can still occur through contaminated surfaces to other patients or staff. This overlooks the importance of interrupting the mode of transmission via contact with contaminated surfaces. The professional reasoning process for similar situations should involve a systematic assessment of the chain of infection, identifying the potential source, evaluating the modes of transmission present, contact, droplet, airborne, vector-borne, and assessing the susceptibility of the host population. Based on this assessment, the infection preventionist should then prioritize interventions that most effectively break the chain at its weakest link. This often involves a multifaceted approach, but understanding the primary mode of transmission and the most feasible and impactful intervention is crucial for effective infection control. Question 8. The control framework reveals a persistent increase in central line-associated bloodstream infections, CLABSI, a hospital unit, despite the consistent application of the established central line insertion and maintenance bundles. Which performance improvement approach is most aligned with regulatory expectations for addressing this trend and ensuring patient safety? Option A. Conduct a comprehensive root cause analysis, RCA, involving frontline staff, leadership, and relevant support departments to identify systemic factors contributing to the increased CLABSI rates. Option B. Focus disciplinary actions on individual nurses identified as having the highest number of central line insertions. Option C. Mandate additional mandatory training for all nursing staff on the existing central line insertion and maintenance bundles. Option D. Implement a new, unproven antimicrobial dressing technology for all central lines immediately. The correct answer is A. Conduct a comprehensive root cause analysis, RCA, involving frontline staff, leadership, and relevant support departments to identify systemic factors contributing to the increased CLABSI rates. Explanation. The control framework reveals a scenario where a healthcare facility is experiencing an increase in healthcare-associated infections, despite existing infection prevention protocols. This situation is professionally challenging because it directly impacts patient safety and the facility's reputation, requiring a systematic and evidence-based approach to identify the root causes and implement effective improvements. The CIC certification emphasizes a commitment to continuous quality improvement in infection prevention, necessitating a robust methodology to address such performance deficits. The correct approach involves a comprehensive root cause analysis, RCA. This methodology systematically investigates the underlying factors contributing to the increased HAIs, moving beyond superficial symptoms to uncover systemic issues. RCA typically involves forming a multidisciplinary team, defining the problem clearly, gathering data, identifying contributing factors, determining root causes, and developing and implementing recommendations. This aligns with the principles of performance improvement mandated by regulatory bodies and professional standards in infection prevention, which require facilities to proactively monitor outcomes and implement corrective actions to ensure patient safety and compliance. The CIC exam expects candidates to demonstrate proficiency in such analytical processes. An incorrect approach would be to simply reinforce existing protocols without investigating the reasons for their apparent failure. This reactive measure fails to address the underlying systemic issues that are likely contributing to the increased HAIs. It is ethically problematic as it does not fulfill the professional obligation to ensure the highest possible standard of patient care and may violate regulatory requirements for proactive quality improvement. Another incorrect approach would be to focus solely on individual staff performance without considering broader system factors. While individual accountability is important, attributing the increase in HAIs solely to staff error without a thorough RCA can lead to punitive measures that do not resolve the core problem and can damage staff morale and trust. This approach neglects the systemic nature of many HAIs and the importance of a supportive organizational environment for effective infection prevention. A third incorrect approach would be to implement a new, unproven intervention without a clear understanding of the problem. This could involve adopting a novel technology or practice based on anecdotal evidence or marketing claims, rather than on data-driven analysis of the specific facility's challenges. This is inefficient, potentially costly, and may not address the actual root causes, thus failing to achieve the desired improvement in HAI rates and potentially introducing new risks. The professional decision-making process for similar situations should involve a structured, data-driven approach. When performance metrics decline or adverse events increase, the first step is to acknowledge the issue and initiate a formal quality improvement process. This typically begins with a clear problem statement and the formation of a multidisciplinary team. The team should then employ a systematic methodology like RCA to identify contributing factors and root causes. Based on these findings, targeted, evidence-based interventions should be developed, implemented, and rigorously monitored for effectiveness. This iterative process of assessment, intervention, and evaluation is fundamental to maintaining and improving patient safety and infection prevention standards. Question 9. Benchmark analysis indicates that a healthcare facility is experiencing a cluster of gastrointestinal illnesses and pruritic rashes among patients and staff. Initial clinical suspicion points towards parasitic infections, potentially including protozoa and helminths, with some cases also exhibiting signs suggestive of ectoparasite infestation. The infection prevention team must develop an immediate action plan. Which of the following approaches best aligns with regulatory requirements and best practices for managing such a potential outbreak? Option A. Focus on symptomatic treatment for all affected individuals and wait for definitive laboratory results before considering any further investigative or reporting actions. Option B. Conduct a literature review on common parasitic infections and develop educational materials for staff, without immediate direct intervention or reporting, to allow for further observation of the situation. Option C. Initiate enhanced surveillance for parasitic infections, conduct thorough environmental assessments to identify potential sources, implement targeted diagnostic testing for affected individuals and close contacts, and immediately notify relevant public health authorities of the suspected outbreak. Option D. Implement general hand hygiene and isolation precautions for all patients, assuming a broad-spectrum parasitic transmission, and defer reporting to public health until a clear pattern emerges. The correct answer is C. Initiate enhanced surveillance for parasitic infections, conduct thorough environmental assessments to identify potential sources, implement targeted diagnostic testing for affected individuals and close contacts, and immediately notify relevant public health authorities of the suspected outbreak. Explanation: scenario analysis. This scenario presents a common challenge in infection prevention, responding to a cluster of suspected parasitic infections in a healthcare setting. The professional challenge lies in the need for rapid, accurate identification and containment of the source and transmission pathways, while also ensuring patient safety and adherence to regulatory requirements. The diversity of parasitic organisms, protozoa, helminths, ectoparasites, and their varied transmission routes necessitates a nuanced and evidence-based approach. Failure to act decisively and appropriately can lead to widespread outbreaks, increased patient morbidity and mortality, and significant reputational damage to the facility. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes immediate public health and patient safety. This includes prompt notification of public health authorities, as mandated by federal and state regulations, e.g., CDC guidelines, state health department reporting requirements for communicable diseases. Simultaneously, implementing enhanced surveillance and diagnostic testing is crucial to confirm the specific parasitic agents involved and their prevalence. Environmental assessment and remediation, coupled with targeted patient and staff education on hygiene and transmission prevention, are essential to break the chain of infection. This comprehensive strategy aligns with the core principles of infection prevention and control, emphasizing early detection, containment, and prevention of further spread, all within the framework of regulatory compliance. Incorrect approaches analysis, an approach that delays reporting to public health authorities, citing the need for definitive laboratory confirmation, is professionally unacceptable. This failure directly contravenes regulatory mandates for timely reporting of suspected outbreaks of infectious diseases, potentially hindering public health's ability to implement broader control measures and investigate community-wide transmission. An approach that focuses solely on symptomatic treatment of affected individuals, without a concurrent investigation into the source and transmission of the parasites, demonstrates a significant lapse in infection control principles. This neglects the fundamental responsibility to identify and eliminate the root cause of the outbreak, thereby failing to prevent further cases and protect vulnerable populations. An approach that relies on anecdotal evidence or generalized infection control protocols without specific investigation into the suspected parasitic agents is also professionally deficient. Parasitic infections have diverse etiologies and transmission routes, requiring tailored interventions. Generic measures may be ineffective and fail to address the specific risks posed by protozoa, helminths, or ectoparasites, leading to continued transmission. Professional reasoning. Professionals should employ a systematic decision-making process that begins with recognizing the potential for an outbreak. This triggers an immediate assessment of the situation, including gathering information on symptoms, patient demographics, and potential exposures. The next critical step is to consult relevant infection control guidelines and regulatory requirements, particularly those pertaining to outbreak reporting and management. Collaboration with clinical teams, laboratory services, and public health authorities is paramount. The decision-making process should prioritize evidence-based interventions, risk assessment, and continuous evaluation of the effectiveness of implemented control measures. Question 10. The risk matrix shows a high probability of measles transmission within a healthcare facility due to a documented decline in MMR vaccination rates among staff and a recent cluster of cases in the surrounding community. As the infection preventionist, what is the most appropriate initial risk mitigation strategy to address this elevated risk? Option A. Recommend that unvaccinated or incompletely vaccinated staff avoid direct patient contact for an indeterminate period, relying on voluntary vaccination uptake. Option B. Implement a mandatory MMR vaccination policy for all healthcare personnel with documented proof of immunity, coupled with a robust education campaign on the importance of vaccination and the management of vaccine adverse events, while ensuring clear protocols for medical exemptions and a system for reporting any suspected adverse events. Option C. Advise healthcare personnel to practice enhanced droplet precautions for all patient interactions until community measles cases subside, without directly addressing the underlying low vaccination rates. Option D. Focus solely on isolating any patients presenting with symptoms suggestive of measles, assuming staff immunity is sufficient due to prior widespread vaccination. The correct answer is B. Implement a mandatory MMR vaccination policy for all healthcare personnel with documented proof of immunity, coupled with a robust education campaign on the importance of vaccination and the management of vaccine adverse events, while ensuring clear protocols for medical exemptions and a system for reporting any suspected adverse events. Explanation: this scenario is professionally challenging because it requires balancing patient safety, public health mandates, and individual autonomy within the framework of infection control principles. The certified in infection control and prevention (CIC) professional must navigate potential vaccine hesitancy, understand the nuances of vaccine efficacy and safety, and apply evidence-based guidelines to protect vulnerable populations. The risk matrix in this context highlights the potential for disease transmission and outbreaks if immunization rates are suboptimal, underscoring the importance of a proactive and informed approach. The correct approach involves a comprehensive risk assessment that prioritizes evidence-based vaccination strategies aligned with current public health recommendations and regulatory requirements. This includes understanding the principles of herd immunity, the specific indications and contraindications for various vaccines, and the established vaccine schedules. It also necessitates a thorough understanding of how to identify, report, and manage vaccine adverse events, ensuring patient safety and contributing to ongoing vaccine safety surveillance. This approach is ethically and regulatorily sound, as it directly supports the core mission of infection prevention by minimizing the incidence and spread of vaccine-preventable diseases, thereby protecting both individual patients and the broader community. Adherence to guidelines from bodies like the Centers for Disease Control and Prevention (CDC) for vaccine recommendations and the Advisory Committee on Immunization Practices (ACIP) is paramount. An incorrect approach would be to dismiss concerns about vaccine adverse events without proper investigation, or to rely on anecdotal evidence rather than scientific data when assessing vaccine contraindications. This fails to uphold the professional responsibility to provide accurate, evidence-based information and can lead to suboptimal immunization coverage, increasing the risk of outbreaks. Another incorrect approach would be to ignore established vaccine schedules without a clear, documented medical contraindication, potentially compromising the effectiveness of the immunization series. Furthermore, failing to implement a robust system for monitoring and reporting vaccine adverse events is a significant regulatory and ethical failure, hindering public health surveillance and patient safety efforts. The professional decision-making process for similar situations should involve 1. Identifying the specific infection control risk, e.g., low immunization rates for a particular vaccine-preventable disease. 2. Consulting current, evidence-based guidelines and regulatory requirements, e.g., CDC, ACIP. 3. Assessing the potential impact of the risk on patient and community health. 4. Developing strategies to mitigate the risk, which may include education, policy development, and implementation of vaccination programs. 5. Establishing mechanisms for monitoring outcomes and adverse events. 6. Continuously evaluating and updating strategies based on new evidence and evolving public health needs. Question 11. The performance metrics show a higher than expected incidence of severe sepsis in immunocompromised patients admitted with respiratory tract infections. Given this trend, which of the following approaches best reflects an evidence-based infection prevention strategy that considers the host immune response? Option A. Reviewing and optimizing the use of prophylactic antibiotics and antiviral agents based on individual patient risk factors and immune status. Option B. Focusing on environmental cleaning protocols and ensuring adequate ventilation in patient care areas. Option C. Recommending broad-spectrum empirical antibiotic therapy for all patients presenting with respiratory symptoms. Option D. Intensifying surveillance for specific respiratory pathogens and implementing enhanced contact precautions for all admitted patients. The correct answer is D. Intensifying surveillance for specific respiratory pathogens and implementing enhanced contact precautions for all admitted patients. Explanation: this scenario is professionally challenging because it requires an infection preventionist to interpret complex immunological data in the context of patient outcomes and to make evidence-based recommendations for clinical practice. The challenge lies in translating the understanding of innate and adaptive immunity, including humoral and cell-mediated responses, into actionable strategies that align with established infection control principles and patient safety. Careful judgment is required to avoid oversimplification or misapplication of immunological concepts, which could lead to ineffective or even harmful interventions. The correct approach involves a comprehensive evaluation of the patient's immune status in relation to the identified pathogen and the clinical context. This means understanding how the innate immune system provides immediate, nonspecific defense, while the adaptive immune system offers a targeted and memory-based response. Specifically, recognizing the roles of B cells and antibodies in humoral immunity and T cells in cell-mediated immunity is crucial for assessing the patient's ability to fight infection. The best practice is to correlate observed immune responses, or lack thereof, with clinical signs and symptoms, and then to recommend interventions that support or augment the host's immune defenses, such as appropriate antimicrobial therapy, supportive care, and potentially immunomodulatory agents if indicated and within the scope of infection prevention. This aligns with the core principles of infection control, which aim to prevent the transmission of pathogens and minimize the risk of healthcare-associated infections by understanding and mitigating factors that compromise host defenses. An incorrect approach would be to focus solely on one aspect of the immune response without considering the broader picture. For instance, recommending aggressive antimicrobial therapy based only on the presence of a pathogen without assessing the host's immune capacity could lead to antibiotic resistance or disruption of the normal microbiome, which can paradoxically increase infection risk. Another incorrect approach would be to overemphasize the role of innate immunity and neglect the importance of adaptive immunity in clearing certain pathogens or developing long-term protection, potentially leading to delayed or inadequate treatment. Similarly, focusing exclusively on humoral immunity and overlooking the critical role of cell-mediated immunity in intracellular pathogens or viral infections would be a significant oversight. These approaches fail because they do not reflect a holistic understanding of host-pathogen interactions and the multifaceted nature of the immune system, potentially leading to suboptimal patient care and increased infection risk, which is contrary to the ethical and professional obligations of an infection preventionist. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the clinical presentation and the identified pathogen. Second, consider the patient's underlying health status and any factors that might compromise their immune system. Third, evaluate the available data on the host's immune response, considering both innate and adaptive mechanisms. Fourth, consult relevant clinical guidelines and evidence-based literature. Finally, collaborate with the healthcare team to develop and implement a patient-centered infection prevention and management plan that is tailored to the individual's needs and supported by scientific principles. Question 12. Upon reviewing surveillance data and observing direct patient care activities, an infection preventionist notes a consistent pattern of a specific healthcare worker failing to adhere to sterile glove technique during central venous catheter dressing changes, potentially increasing the risk of catheter-related bloodstream infections. The infection preventionist has previously provided general education on sterile technique to the unit. What is the most appropriate immediate course of action for the infection preventionist? Option A. Wait to see if any patients develop signs or symptoms of infection related to central venous catheter care before initiating any further action or reporting. Option B. Privately counsel the healthcare worker on the importance of sterile technique and the observed deviation, encouraging them to improve without involving management. Option C. Immediately report the observed deviation in sterile glove technique to the unit manager and the infection control committee, documenting the specific observations and the potential risk to patient safety. Option D. Assume the healthcare worker will self-correct their technique after the general education provided and monitor for future occurrences without immediate reporting. The correct answer is C. Immediately report the observed deviation in sterile glove technique to the unit manager and the infection control committee, documenting the specific observations and the potential risk to patient safety. Explanation. This scenario presents an ethical dilemma for an infection preventionist, IP, regarding the reporting of a potential breach in adherence to infection control protocols that could have significant implications for patient safety and public health. The challenge lies in balancing the immediate need to address a potential infection risk with the established reporting procedures and the potential consequences for the involved staff member. Careful judgment is required to ensure patient safety while upholding professional integrity and adhering to regulatory mandates. The correct approach involves immediately reporting the observed deviation from protocol to the appropriate supervisor or designated authority, as per established organizational policies and public health guidelines. This aligns with the core ethical responsibility of an IP to protect patients from healthcare-associated infections. Regulatory frameworks, such as those enforced by the Centers for Disease Control and Prevention, CDC, and state health departments, mandate reporting of potential breaches that could lead to infection transmission. This proactive reporting allows for prompt investigation, implementation of corrective actions, and prevention of further harm. An incorrect approach would be to ignore the observed deviation, assuming it was a minor oversight or that the individual staff member would correct it independently. This fails to acknowledge the potential for widespread transmission and the IP's professional obligation to act. Ethically, this constitutes a dereliction of duty and a breach of the trust placed in the IP to safeguard patient well-being. Regulatory failure occurs because it bypasses established reporting mechanisms designed to ensure accountability and systemic improvement. Another incorrect approach would be to confront the individual staff member directly and privately without reporting it through official channels. While direct communication can be valuable, it is insufficient when patient safety is potentially compromised. This approach risks inadequate follow-up, potential denial or minimization of the issue by the staff member, and a failure to trigger the necessary institutional response. It also bypasses the established chain of command and reporting protocols, which are crucial for documentation, investigation, and accountability. A third incorrect approach would be to delay reporting until a patient outcome is confirmed. This is a reactive rather than a proactive stance and places patients at unnecessary risk. The purpose of infection prevention is to prevent infections from occurring in the first place. Waiting for a confirmed case of infection is a failure to implement preventative measures and can lead to a cascade of further infections. This approach is ethically indefensible and a clear violation of regulatory expectations for timely intervention. The professional decision-making process in such situations should involve a clear understanding of organizational policies and relevant public health regulations. When a potential breach of infection control is observed, the IP should first assess the immediate risk to patients. If there is a demonstrable risk, the immediate priority is to report the observation through the established reporting channels, such as to a direct supervisor, infection control committee, or designated safety officer. Documentation of the observation and the reporting action is crucial. This systematic approach ensures that patient safety is prioritized, regulatory requirements are met, and appropriate corrective actions can be implemented. Question 13. Market research demonstrates a significant increase in the prevalence of carbaphnum-resistant Enterobacteriaceae cri isolates within a healthcare facility over the past 6 months. The infection prevention and control team needs to assess the impact of their current interventions and determine the most appropriate next steps. Which of the following approaches best addresses this challenge from an analysis and interpretation perspective, focusing on impact assessment within the U.S. regulatory framework? Option A. Initiate a broad, facility-wide educational campaign for all staff on the general risks of antibiotic resistance, without specific data linking current CRE trends to particular practices. Option B. Conduct a retrospective analysis of surveillance data to identify specific patient populations and units with the highest CRE burden, correlating these findings with the facility's antimicrobial prescribing patterns and the adherence rates to contact precautions for patients colonized or infected with CRE. Option C. Request a review of the facility's antibiotic formulary by the pharmacy department to identify potential alternatives to carbaphnums, irrespective of the current CRE resistance trends or the clinical necessity for carbaphnum use. Option D. Focus solely on increasing the frequency of environmental cleaning in high-risk areas, assuming this is the primary driver of the observed CRE increase, without analyzing patient-specific data or antimicrobial use. The correct answer is B. Conduct a retrospective analysis of surveillance data to identify specific patient populations and units with the highest CRE burden, correlating these findings with the facility's antimicrobial prescribing patterns and the adherence rates to contact precautions for patients colonized or infected with CRE. Explanation. This scenario presents a common challenge in infection prevention, translating complex microbiological data into actionable strategies to combat antimicrobial resistance, AMR. The professional challenge lies in accurately identifying trends, understanding their implications for patient care and public health, and then evaluating the efficacy of implemented interventions within the strict confines of regulatory compliance. This requires a nuanced understanding of both scientific principles and the specific legal and ethical obligations governing healthcare facilities. The correct approach involves a systematic and evidence-based evaluation of resistance patterns, directly linking observed trends to the effectiveness of current infection control measures and antimicrobial stewardship programs. This aligns with the core principles of infection prevention and control, which are mandated by regulatory bodies like the Centers for Disease Control and Prevention, CDC, and enforced through accreditation organizations and state health departments in the U.S. Specifically, guidelines from the CDC's National Healthcare Safety Network, NHSN, provide frameworks for surveillance and reporting of AMR, which are essential for identifying trends and evaluating interventions. Ethical considerations also demand that healthcare providers proactively address AMR to protect patient safety and contribute to the broader public health effort to preserve the efficacy of antibiotics. An incorrect approach would be to rely solely on anecdotal evidence or the opinions of individual clinicians without rigorous data analysis. This fails to meet the regulatory requirement for data-driven decision-making and can lead to ineffective or even harmful interventions. Another incorrect approach is to focus on a single resistant organism in isolation, ignoring the broader epidemiological context and potential for cross-resistance or synergistic effects. This overlooks the systemic nature of AMR and the need for comprehensive strategies. Finally, an approach that prioritizes cost-saving measures over evidence-based interventions for AMR control would be ethically and regulatorily unsound, as patient safety and public health must take precedence. Professionals should employ a decision-making process that begins with robust data collection and analysis, utilizing established surveillance systems. This data should then be interpreted in the context of current infection control and antimicrobial stewardship practices. Interventions should be designed based on this interpretation, and their effectiveness must be continuously monitored and evaluated against established metrics. This iterative process ensures that strategies remain relevant, effective, and compliant with all applicable regulations and ethical standards. Question 14. Quality control measures reveal that the infection prevention team is preparing a report on Clostridium difficile infection, CDI, rates for the last quarter. The team needs to accurately communicate the risk of patients acquiring a new CDI during their hospital stay within this period. Which of the following approaches best reflects the appropriate epidemiological measure for this specific communication goal? Option A. Report the incidence rate of new CDI cases per 1,000 patient days for the quarter. Option B. Report the ratio of total CDI cases to total patient days for the quarter. Option C. Report the prevalence of CDI cases identified at the end of the quarter. Option D. Report the proportion of all healthcare-associated infections that were CDI during the quarter. The correct answer is A. Report the incidence rate of new CDI cases per 1,000 patient days for the quarter. Explanation. This scenario presents a professional challenge because it requires the infection preventionist to accurately interpret and apply epidemiological measures to understand disease frequency within a healthcare setting. The challenge lies in distinguishing between incidence and prevalence, and selecting the appropriate measure to communicate the risk of acquiring a new infection versus the existing burden of infection. Misinterpreting these measures can lead to flawed decision-making regarding resource allocation, intervention strategies, and communication with stakeholders, potentially impacting patient safety and public health. The correct approach involves selecting the measure that accurately reflects the rate of new infections occurring over a defined period. This aligns with the fundamental principles of infection prevention, which aim to identify and mitigate the risk of new healthcare-associated infections. Specifically, using incidence to describe the occurrence of new cases of Clostridium difficile infection, CDI, over a quarter accurately quantifies the risk of patients acquiring CDI during their hospital stay within that time frame. This measure is crucial for evaluating the effectiveness of infection control interventions aimed at preventing new infections. The CIC certification emphasizes the application of epidemiological principles to real-world infection prevention practice, and accurately reporting incidents is a core competency. An incorrect approach would be to use prevalence to describe the occurrence of new CDI cases. Prevalence measures the proportion of existing cases of a disease in a population at a specific point in time, or over a period. While prevalence is useful for understanding the overall burden of a disease, it does not specifically capture the rate at which new infections are occurring. Using prevalence in this context would conflate existing infections with newly acquired ones, obscuring the impact of interventions designed to prevent new cases. This misrepresentation could lead to an inaccurate assessment of the infection control program's effectiveness. Another incorrect approach would be to report a simple ratio of total CDI cases to total patient days, without specifying whether these are new or existing cases, or without defining the time period. While patient days are a common denominator in healthcare epidemiology, a raw ratio without the context of incidence or prevalence can be ambiguous. It fails to distinguish between the ongoing presence of infection and the rate of new acquisition, hindering targeted interventions. Finally, an incorrect approach would be to report the proportion of patients with any healthcare-associated infection without specifically focusing on CDI. While understanding the overall burden of HAIs is important, the question specifically asks about CDI. Focusing on a broader, less specific measure would fail to address the particular issue of CDI incidence and the effectiveness of interventions targeting this specific pathogen. The professional reasoning process for this situation involves 1. Clearly defining the epidemiological question. What is the rate of new CDI infections occurring in the facility during the specified period? 2. Identifying the appropriate epidemiological measure. Incidence is the measure that quantifies the rate of new cases. 3. Applying the chosen measure correctly. Calculate the incidence rate of CDI over the quarter. 4. Communicating the findings accurately. Report the incidence rate clearly, specifying the time period and the population at risk. 5. Using the data to inform action. Analyze trends in the incidence rate to evaluate the effectiveness of infection control strategies and identify areas for improvement. Question 15. Examination of the data shows a consistent increase in healthcare-associated infections, high, within a specific unit over the past 3 quarters, with a notable rise in Clostridioides difficile infections. The data has been collected and reported according to the National Healthcare Safety Network, NHSN, protocol. Which of the following approaches best aligns with the principles of process optimization for surveillance systems and reporting requirements? Option A. Immediately implement a new, unproven disinfection technology for all patient rooms in the unit, based on a single positive anecdotal report from a colleague in another facility. Option B. Initiate a comprehensive review of the unit's infection prevention practices, focusing on hand hygiene compliance, environmental cleaning protocols, and antibiotic stewardship, using the collected HAI data to guide the investigation and identify specific areas for improvement. Option C. Temporarily halt reporting of HAI data for the affected unit until the cause of the increase can be definitively identified, to avoid reporting potentially incomplete or misleading information. Option D. Focus on improving the documentation of existing infection prevention measures without analyzing the underlying trends in the HAI data. The correct answer is B. Initiate a comprehensive review of the unit's infection prevention practices, focusing on hand hygiene compliance, environmental cleaning protocols, and antibiotic stewardship, using the collected HAI data to guide the investigation and identify specific areas for improvement. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for data-driven improvements with the strict reporting requirements and data integrity standards mandated by national surveillance systems. Misinterpreting or misapplying data can lead to ineffective interventions, wasted resources, and potentially inaccurate public health messaging. Careful judgment is required to ensure that any proposed process optimization is grounded in reliable data and aligns with established reporting protocols. The correct approach involves a systematic review of the surveillance data to identify specific trends or anomalies that warrant investigation and potential process optimization. This aligns with the core principles of infection prevention and control, which emphasize evidence-based practice. Specifically, it adheres to the guidelines of national surveillance systems, such as those promoted by the Centers for Disease Control and Prevention, CDC, in the U.S., which emphasize the importance of accurate data collection, analysis, and reporting for identifying public health threats and guiding interventions. Optimizing processes based on this analyzed data ensures that interventions are targeted and effective, contributing to the overall goals of national surveillance. An incorrect approach that focuses solely on anecdotal evidence or personal observations fails to meet the rigorous data-driven requirements of national surveillance systems. This bypasses the systematic analysis necessary to validate concerns and can lead to interventions based on bias rather than objective findings, violating the principle of evidence-based practice. Another incorrect approach that involves immediate, unverified implementation of changes without a thorough data analysis risks disrupting existing, potentially effective protocols. This can lead to the introduction of new risks or the masking of underlying issues, undermining the integrity of the surveillance system and the effectiveness of infection prevention efforts. It also fails to meet the reporting requirements that necessitate justification for changes based on analyzed data. A further incorrect approach that involves withholding potentially significant findings from the surveillance system, even if the cause is not immediately clear, is a direct violation of reporting requirements. National surveillance systems rely on the timely and complete reporting of data to identify trends and outbreaks. Failure to report can have serious public health consequences. Professionals should employ a decision-making framework that prioritizes data integrity and adherence to established surveillance protocols. This involves 1. Ensuring accurate and complete data collection. 2. Conducting thorough analysis of collected data to identify trends, outliers, or potential issues. 3. Correlating findings with established benchmarks and reporting requirements. 4. Developing evidence-based recommendations for process optimization. And 5. Reporting findings and proposed changes through the appropriate channels as dictated by national surveillance guidelines. Question 16. Assessment of a surgical unit's process for preventing surgical site infections reveals a need for optimization. Which of the following approaches, if implemented, would most effectively align with current U.S. regulatory frameworks and best practices for SSI prevention? Option A. Focusing primarily on ensuring that surgical staff are aware of the importance of hand hygiene before entering the operating room. Option B. Implementing a standardized preoperative checklist to assess and manage patient-specific risk factors, ensuring strict adherence to sterile technique during all surgical procedures, and optimizing the timing and selection of antibiotic prophylaxis based on current guidelines. Option C. Relying solely on post-operative wound cultures to identify infections after they have occurred, without proactive preoperative or intraoperative interventions. Option D. Streamlining the surgical scheduling process to maximize operating room utilization, with the understanding that minor deviations from sterile technique may occasionally occur to maintain efficiency. The correct answer is B. Implementing a standardized preoperative checklist to assess and manage patient-specific risk factors, ensuring strict adherence to sterile technique during all surgical procedures, and optimizing the timing and selection of antibiotic prophylaxis based on current guidelines. Explanation: this scenario is professionally challenging because it requires the infection preventionist to balance the immediate needs of patient care with the long-term goals of reducing surgical site infections, SSI, through systematic process optimization. The pressure to maintain surgical throughput can sometimes conflict with the time and resources needed for thorough preoperative assessments and adherence to best practices. Careful judgment is required to identify and implement interventions that are both effective and feasible within the existing healthcare system. The correct approach involves a multifaceted strategy that directly addresses known risk factors for SSIs and aligns with established infection prevention guidelines. This includes a comprehensive preoperative assessment to identify and manage patient-specific risk factors, strict adherence to sterile technique throughout the surgical procedure, and appropriate antibiotic prophylaxis. Furthermore, it emphasizes post-operative surveillance and feedback to the surgical team, which is crucial for continuous quality improvement and reinforcing best practices. This approach is justified by the Centers for Disease Control and Prevention, CDC, guidelines for the prevention of surgical site infections, which are foundational for CIC certification. These guidelines are evidence-based and represent the current standard of care in the United States for preventing SSIs. An incorrect approach that focuses solely on antibiotic timing without addressing other critical factors like patient optimization or sterile technique fails to provide a holistic prevention strategy. This is a regulatory failure because it neglects the comprehensive nature of SSI prevention as outlined by national guidelines. Another incorrect approach that prioritizes surgical efficiency over meticulous sterile technique is ethically problematic and a regulatory failure. It compromises patient safety by increasing the risk of contamination and subsequent infection, directly contravening the fundamental ethical obligation to do no harm and the regulatory requirement to adhere to infection control standards. An approach that neglects post-operative surveillance and feedback misses a critical opportunity for learning and improvement, hindering the facility's ability to identify trends and address systemic issues, which is a failure in quality improvement mandates often embedded within healthcare regulations. The professional reasoning process for similar situations should involve a systematic evaluation of the SSI prevention process, starting with identifying the core components of effective prevention as defined by regulatory bodies and evidence-based guidelines. This includes assessing patient risk factors, adherence to intraoperative protocols, and post-operative care. When faced with potential conflicts, such as time constraints, the infection preventionist must advocate for evidence-based practices, using data to demonstrate the long-term benefits of prevention, including reduced patient morbidity, mortality, and healthcare costs. This involves clear communication with surgical teams and hospital leadership, emphasizing the shared responsibility for patient safety and the importance of a proactive, systematic approach to infection control. Question 17. Which approach would be most appropriate for an infection preventionist to recommend when a healthcare facility experiences a critical shortage of a primary disinfectant used for terminal cleaning of patient rooms, impacting the ability to adhere to standard protocols? Option A. Recommend suspending all terminal cleaning of patient rooms until the primary disinfectant is fully restocked. Option B. Suggest that environmental services staff focus solely on manual cleaning, without disinfection for all patient rooms during the shortage. Option C. Immediately escalate the issue to facility leadership and supply chain to expedite procurement of the disinfectant or an approved alternative, while simultaneously exploring evidence-based, temporary modifications to cleaning protocols for low-risk areas, ensuring high-risk areas and terminal cleaning remain prioritized with available resources or approved substitutes. Option D. Advise environmental services staff to dilute the existing disinfectant to a lower concentration to extend its availability for terminal cleaning. The correct answer is C. Immediately escalate the issue to facility leadership and supply chain to expedite procurement of the disinfectant or an approved alternative, while simultaneously exploring evidence-based, temporary modifications to cleaning protocols for low-risk areas, ensuring high-risk areas and terminal cleaning remain prioritized with available resources or approved substitutes. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate patient care needs and the long-term implications of environmental hygiene practices. The healthcare facility is facing a critical shortage of a specific disinfectant crucial for terminal cleaning of patient rooms, a process directly linked to preventing healthcare-associated infections. The infection preventionist, IP, must balance the immediate demand for cleaning with the need to maintain established protocols and ensure the safety of future patients. This requires careful judgment, adherence to regulatory standards, and ethical consideration for both current and future patient populations. The correct approach involves a multifaceted strategy that prioritizes patient safety and regulatory compliance while actively seeking sustainable solutions. This includes immediately escalating the issue to facility leadership and the supply chain department to secure an alternative disinfectant or replenish stock, while simultaneously implementing a temporary, evidence-based protocol for less critical cleaning tasks or for rooms occupied by patients with lower infection risk, ensuring that high-risk areas and terminal cleaning are not compromised. This approach aligns with the principles of infection prevention as outlined by the Centers for Disease Control and Prevention, CDC, guidelines for environmental infection control in healthcare facilities, which emphasize the importance of appropriate cleaning and disinfection for reducing pathogen transmission. Ethically, it upholds the duty to protect patients from harm by not compromising essential infection control measures. Implementing a temporary measure of diluting the existing disinfectant beyond recommended concentrations is an incorrect approach. This action directly violates manufacturer instructions and established evidence-based practices for disinfectant efficacy. The regulatory failure lies in deviating from approved protocols, which could lead to inadequate disinfection and an increased risk of HAI transmission, contravening guidelines from bodies like the CDC and potentially the Occupational Safety and Health Administration, OSHA, regarding safe and effective use of chemicals. Ethically, it prioritizes expediency over patient safety, failing to uphold the duty of care. Another incorrect approach would be to cease all terminal cleaning of patient rooms until the specific disinfectant is restocked. This creates a significant gap in infection control, dramatically increasing the risk of pathogen transmission between patients and to the environment. This directly contradicts the fundamental principles of environmental hygiene and infection prevention, failing to meet the standards set by regulatory bodies and professional organizations. The ethical failure is profound, as it knowingly exposes patients to preventable risks. Finally, relying solely on manual cleaning without disinfection for all patient rooms during the shortage is also an incorrect approach. While manual cleaning removes gross soil, it does not eliminate or inactivate microorganisms to the extent required to prevent transmission. This would be a failure to implement appropriate disinfection strategies as mandated by infection control guidelines, increasing the risk of HAIs. The ethical implication is a failure to provide a safe healthcare environment. The professional reasoning process for this situation should involve 1. Recognizing the critical nature of the disinfectant shortage and its potential impact on patient safety. 2. Immediately communicating the issue to relevant stakeholders, leadership, supply chain, clinical staff. 3. Consulting infection prevention guidelines and evidence-based practices to determine acceptable interim measures, if any, that do not compromise patient safety. 4. Actively participating in the resolution of the supply chain issue. 5. Documenting all actions taken and decisions made. Question 18. Implementation of a new rapid diagnostic test for a potentially airborne pathogen in an acute care hospital requires a robust infection prevention strategy for specimen collection and transport. A patient presents with symptoms suggestive of this pathogen. Which of the following approaches best ensures patient safety and prevents transmission within the facility and to laboratory personnel, while facilitating timely diagnosis? Option A. The specimen will be collected by the nursing staff using surgical masks and gloves and placed in a standard specimen bag for transport. Option B. The nursing staff will collect the specimen using airborne precautions, including an N95 respirator, and transport it immediately to the laboratory in a sealed biohazard bag. Option C. The specimen will be collected by the laboratory technician once the patient is moved to a negative pressure isolation room, which may take several hours. Option D. The clinical team will wait for the patient's symptoms to resolve before collecting the specimen to minimize potential exposure. The correct answer is B. The nursing staff will collect the specimen using airborne precautions, including an N95 respirator, and transport it immediately to the laboratory in a sealed biohazard bag. Explanation. This scenario presents a common challenge in acute care hospitals, balancing the need for rapid diagnostic testing with the imperative to maintain stringent infection prevention protocols. The professional challenge lies in ensuring patient safety and preventing healthcare-associated infections, while not unduly delaying necessary diagnostic procedures that could impact patient care decisions. Careful judgment is required to select an approach that is both effective and compliant with established guidelines. The correct approach involves a multifaceted strategy that prioritizes patient isolation based on risk assessment, utilizes appropriate personal protective equipment, PPE, for specimen collection, and ensures timely transport of specimens to the laboratory under controlled conditions. This aligns with the principles of standard precautions and transmission-based precautions as outlined by the Centers for Disease Control and Prevention, CDC, which are foundational to infection control in U.S. healthcare settings. Specifically, the CDC guidelines emphasize the importance of identifying and isolating patients with suspected or confirmed infectious agents, using appropriate PPE to prevent transmission, and ensuring safe handling and transport of specimens. This approach minimizes the risk of pathogens spread within the facility and to laboratory personnel. An incorrect approach would be to proceed with specimen collection without considering the patient's potential infectious status, thereby failing to implement appropriate transmission-based precautions if indicated. This directly violates the principles of standard precautions, which assume all patients are potentially infectious, and the specific guidance on transmission-based precautions for airborne, droplet, or contact precautions. Another incorrect approach would be to delay specimen collection indefinitely due to perceived logistical challenges, which could compromise patient care and diagnostic accuracy, and is not supported by infection control guidelines that aim to facilitate, not hinder, necessary medical procedures when performed safely. Finally, an approach that relies solely on the laboratory to manage all aspects of specimen safety without the active involvement of the clinical team in initial containment and transport would be flawed, as infection prevention is a shared responsibility. The professional reasoning process for similar situations should involve a systematic risk assessment of the patient's condition and potential for infectiousness, followed by the application of relevant infection control guidelines, e.g., CDC standard and transmission-based precautions. This includes identifying the necessary PPE for the specific suspected pathogen, ensuring proper specimen collection techniques, and establishing clear protocols for specimen transport to prevent environmental contamination and exposure to healthcare personnel. Collaboration between clinical staff, infection preventionists, and laboratory personnel is crucial for developing and implementing effective strategies. Question 19. Risk assessment procedures indicate a cluster of patients presenting with similar gastrointestinal symptoms within a specific unit over a 48-hour period. Which of the following represents the most appropriate initial approach to investigating this potential outbreak? Option A. Immediately implement enhanced environmental cleaning protocols for the entire unit and administer broad-spectrum antibiotics to all symptomatic patients. Option B. Develop a clear and specific case definition for the gastrointestinal illness, initiate systematic data collection on affected patients, and begin analyzing the data to identify potential common exposures or sources. Option C. Rely on the observations and anecdotal reports from nursing staff regarding potential causes and focus on isolating any patients with diarrhea. Option D. Conduct a thorough review of all patient medical records from the past month to identify any previously undocumented gastrointestinal complaints. The correct answer is A. Immediately implement enhanced environmental cleaning protocols for the entire unit and administer broad-spectrum antibiotics to all symptomatic patients. Explanation: scenario analysis. This scenario presents a common challenge in infection prevention. A cluster of healthcare-associated infections, high, that could indicate an outbreak. The professional challenge lies in efficiently and accurately identifying the source and implementing effective control measures to protect patients and staff, while adhering to established outbreak investigation protocols. The urgency of potential patient harm necessitates a swift yet systematic response. Correct approach analysis. The correct approach involves a systematic, multi-step process that aligns with standard outbreak investigation methodologies, as outlined by recognized infection control bodies and regulatory frameworks relevant to the CIC certification. This includes clearly defining a case, meticulously collecting and analyzing data to identify patterns and potential sources, and implementing evidence-based control measures. This structured approach ensures that interventions are targeted, effective, and justifiable, minimizing unnecessary disruption and resource expenditure while maximizing patient safety. The emphasis on a clear case definition is paramount for accurate data collection and analysis, preventing both under- and overcounting of cases. Incorrect approach is analysis, an approach that prioritizes immediate, broad-spectrum antibiotic administration without a confirmed causative agent or clear epidemiological link is procedurally flawed. This bypasses the critical steps of case identification and data analysis, potentially leading to the overuse of antibiotics, contributing to antimicrobial resistance, and failing to address the root cause. If it's not an antibiotic-susceptible organism, it also neglects the systematic investigation required to understand the transmission dynamics. An approach that focuses solely on environmental cleaning without first establishing a link between the environment and the cases is premature and inefficient. While environmental hygiene is crucial An outbreak investigation requires identifying the specific mode of transmission. Without this, resources may be misdirected, and the actual source of the outbreak might be missed. This approach fails to follow the logical progression of an investigation, which moves from defining cases to identifying risk factors and sources. An approach that relies on anecdotal evidence and staff opinions without systematic data collection and analysis is unprofessional and unreliable. While staff observations are valuable, they must be corroborated by objective data. This method lacks the rigor required for a formal outbreak investigation, potentially leading to incorrect conclusions and ineffective control measures. It fails to adhere to the principles of evidence-based practice fundamental to infection prevention. Professional reasoning. Professionals should approach potential outbreaks by first activating their facility's outbreak response plan. This plan typically outlines the steps for case identification, data collection, including demographic, clinical, and exposure information, laboratory testing, epidemiological analysis, e.g., calculating attack rates, identifying common exposures, and the implementation of control measures. The decision-making process should be guided by the principles of public health and patient safety, ensuring that interventions are proportionate to the identified risk and based on the best available evidence. Regular communication with relevant stakeholders, including healthcare providers, laboratory staff, and administration, is also essential throughout the investigation. Question 20. During the evaluation of a patient admitted with a suspected urinary tract infection, laboratory results reveal a gram-negative bacterium resistant to multiple antibiotic classes, including carbapenems. The patient is currently in a semi-private room with another patient who is immunocompromised. What is the most appropriate immediate infection control intervention to implement? Option A. Assume the resistance is limited to the initial antibiotic and focus solely on treating the urinary tract infection without further investigation into the resistance mechanism. Option B. Delay enhanced environmental cleaning until the patient is discharged to minimize disruption to care. Option C. Continue with standard precautions only, as the patient is not exhibiting signs of active infection beyond the UTI symptoms. Option D. Implement contact precautions for the patient. Ensure appropriate specimen collection for further microbiological characterization, and initiate enhanced environmental cleaning of the patient's immediate care area. The correct answer is D. Implement contact precautions for the patient, ensure appropriate specimen collection for further microbiological characterization, and initiate enhanced environmental cleaning of the patient's immediate care area. Explanation. This scenario presents a professional challenge due to the critical nature of antibiotic resistance and the potential for widespread transmission within a healthcare setting. Certified in infection control and prevention, CIC, professional must balance immediate patient needs with the long-term imperative of preventing the spread of multi-drug-resistant organisms, MDRO. Careful judgment is required to implement effective interventions that are both evidence-based and practical within the facility's resources and operational flow. The correct approach involves a multifaceted strategy that directly addresses the identified MDRO, focusing on containment and eradication. This includes implementing contact precautions for the patient, ensuring appropriate specimen collection for further characterization of the organism, and initiating a targeted environmental cleaning protocol. This approach is justified by the Centers for Disease Control and Prevention, CDC, guidelines for the prevention and control of healthcare-associated infections, HI, which emphasize the importance of early detection, isolation, and environmental disinfection to break the chain of transmission for MDRO. Specifically, the CDC's recommendations for managing patients with CRE, carbapenem-resistant Enterobacteriaceae, or other gram-negative resistance mechanisms align with this strategy by advocating for contact precautions, thorough room disinfection, and appropriate communication with healthcare personnel. An incorrect approach would be to solely rely on standard precautions without augmenting them with contact precautions. This fails to acknowledge the specific risk posed by a gram-negative organism with documented resistance to multiple antibiotic classes, such as CRE. Standard precautions are designed for routine care, whereas contact precautions are indicated for pathogens that can be transmitted by direct or indirect contact, which is a known route for CRE. This failure to escalate precautions directly contravenes infection control best practices and regulatory expectations for preventing MDRO transmission. Another incorrect approach would be to delay environmental cleaning until the patient is discharged. This significantly increases the risk of environmental contamination and subsequent transmission to other patients or healthcare workers. MDRO, particularly gram-negative bacteria, can survive on surfaces for extended periods, making prompt and thorough disinfection of the patient's environment crucial. This delay represents a failure to implement timely and effective environmental control measures, a cornerstone of infection prevention. A third incorrect approach would be to assume the resistance mechanism is limited to the initial antibiotic and not investigate further. The emergence of gram-negative resistance, especially to carbapenems, necessitates a comprehensive understanding of the specific resistance mechanisms present. This information is vital for guiding appropriate antimicrobial therapy, informing surveillance efforts, and tailoring infection control interventions. Failing to pursue further microbiological characterization leaves a critical gap in knowledge and hinders effective management. The professional decision-making process for similar situations should involve a systematic risk assessment. This includes identifying the pathogen, understanding its resistance profile and transmission routes, evaluating the patient's clinical status and potential for shedding, and assessing the healthcare environment. Based on this assessment, the CIC professional should then implement evidence-based interventions, such as appropriate isolation precautions, environmental cleaning protocols, and communication strategies, while continuously monitoring the situation and adjusting the plan as needed. Adherence to established guidelines from authoritative bodies like the CDC is paramount.